Serial extraction. Serial extraction is a procedure which has been of interest to the dentist since many years. Bunin, in 1743, first proposed the planned extraction of certain deciduous teeth, followed by specific permanent teeth for the purpose of alignment of the teeth in the dental arch. The term serial extraction was first used by children in the year 1929, who termed it as the procedure where some deciduous teeth are extracted followed by specific permanent teeth to attain a proper alignment of the arch. So, serial extraction can be defined as a procedure that includes planned and progressive extraction of certain deciduous teeth, followed by later specific permanent teeth in an orderly sequence and predetermined manner, so that to guide the erupting permanent teeth in more favorable position. That is, serial extraction requires, first of all, extraction of the primary teeth, later on, which is followed by extraction of specific permanent teeth. Now, all this is done in order for the proper alignment of all the teeth in the dental arch at a particular point of time. Now, let us see what is the main objective behind or the main purpose behind the procedure of serial extraction. So, the main procedure of serial extraction, it helps in any future orthodontic problems, prevention of the future orthodontic problems, and preventing the need of extensive appliance therapy. That is, to prevent the future orthodontic problems or malocclusions to prevail in dentition of a child, so as to prepare the child in a predetermined manner. So, there are certain principles under which serial extraction is laid down. But before moving on to the principles, we'll have a look at the history. As we already know, Jellering gave the name serial extraction. There are certain scientists who had contributed in the field of serial extraction are Nance, Lloyd, Dwell, and Mine. Nance is known as the father of serial extraction, and Tweed and the other scientists made several contributions in the field of serial extraction. So the main rationale behind the serial extraction is based on few principles. That is, the first principle is the tooth material and the arch length deficiency. That is, if there is any discrepancy between the total tooth material, which can be calculated by summing up the mesodistal widths of all the individual teeth present at that point of time, and the total arch length, which is also calculated as a perimeter from the molar of one side to the molar of the other side. So if there is any disbalance or discrepancy between the two, for example, if the total tooth material is greater than the arch length, then there will be a deficiency of the space and will further lead to crowding of teeth. In such cases, we can do serial extraction procedure. Serial extraction also requires physiological movement of teeth in the eruption or in the spaces which are emptied by extraction. So, the eruptive forces of the teeth guide the movement of the teeth in those spaces, further closing the space. So, there are certain indications, there are certain case selection criteria for serial extraction. In each and every case, we cannot do simply serial extraction, but it requires a particular criteria or particular indications. The indications are as following. First And the foremost thing is that serial extraction is indicated in those arch where the tooth material is excess of the arch length or the arch perimeter. It is generally indicated in class 1 type of malocclusion, wherein the patient is having a straight profile. Then also it is indicated in the cases of absence of physiological spaces like primate space, the Siemens space, which are present between the lateral incisor and the canine, which further help in placing or eruption of the permanent teeth in proper sequence and proper order. So if these spaces are absent, we can go for serial extraction. Furthermore, in the cases where there is precautious exfoliation or precautious eruption of certain teeth, this may also lead to crowding. Now, in the cases where there is ankylosis of particular teeth in the oral cavity, which will lead to the arch length deficiency, in such cases, we can also progress to serial extraction. Then if there is gingival recession in particular teeth, or if particular teeth are situated more labially in the dental arch, if the permanent incisors are erupting more lingually, then also if there is abnormal or asymmetrical resorption of the root of the primary canines, if there is any flaring of the roots or ectopic eruption of a particular tooth in the oral cavity, if there is a transposition of the tooth or rotation of the tooth, in the case of crowded dentition, maxillary and mandibular protrusion, in the case of deleterious oral habits like tongue thirsting, thumb sucking, in the case where there is unusual shape or anomalous shape of the crown of the tooth, which will again lead to crowding or loss of arch space. Then also in the case of maxillomandibular dentoalveolar disproportion. In such cases, we can undergo the process of serial extraction. Now, furthermore, there are certain contraindications because there are certain things or certain criteria in which we cannot do serial extraction at all. These cases can be if there is class 2 or class 3 malocclusion in the patient. In the case of anodontia, that is, if particular teeth are present, it can be, and particular teeth are absent from the arch, it can be either partial or total anodontia, oligodontia, in which there are lesser number of teeth in the dental arch. If physiological spaces are present, then there is no need of serial extraction. So in the case of space dentition, we have particular spaces for eruption of the permanent seeds. So why will we use the term serial extraction or use the procedure? Then in the case of midline diastema, that means already space is present in the dental arch. In the case of class 1 malocclusion where minimum discrepancy is present, in such cases, we can go on further with proximal stripping and other minor procedures for creating of minor space discrepancies which are present. Then, if the primary molars are heavily filled, that means there is increased carious activity in the arch. Then also in such cases, serial extraction is contraindicated. Further, if there is an open bite or the deep bite present in the patient, we do not go with the procedure of serial extraction. If there is reverse overjet or rotations, we cannot do serial extractions to correct the dentition. In the case of unilateral absence of particular teeth or congenital absence of particular teeth in the arches, then we do not go with the procedure of serial extraction. For example, if there are some unerupted or malformed teeth, we cannot do serial extraction in such cases. Then, For example, if the patient is having a problem of cleft lip and palate, serial extraction is totally contraindicated in such cases. Now let us see what are the advantages of the procedure of serial extraction. It has certain advantages over fixed and removable orthodontic therapy. First of all, serial extraction is a more physiological process. That means it requires physiological movement of tooth like tipping motion and displacement for the tooth to move in the places of extracted teeth. Thus, normal physiological eruptive forces are required or are used by the tooth to move in the spaces created. Then, the psychological trauma to the patient in the case of serial extraction is less because it will avoid any further large appliances, then brackets, bands, and all, which is also painful to the patient sometimes. It also eliminates the duration of the multi-banded orthodontic treatment. It is helps the patient to maintain a proper oral hygiene, reducing the further risk of any caries process. Then it also protects the health of the dental supporting tissues because they do not cause any harm to the supporting tissues which can be harmed by orthodontic appliances. The retention phase or the retention period which is there used after fixed orthodontic therapy can also be avoided. Further, last but not the least, more stabler results are obtained by serial extraction procedure because a harmony or a stability is obtained by extraction of the selective teeth between the arch length and the tooth material. So, it is superior to the orthodontic treatment if undertaken at a proper time. But with these advantages come a few disadvantages. Serial extraction does not require any single approach, that is, each patient is different. They need formulation of an entirely different treatment plan. Then, the treatment plan or the treatment time in the serial extraction procedure is more prolonged. It requires over 2 to 3 years, and multiple visits are required by the patient to the dentist. So, the patient may have some psychological trauma or may not be able to cope up with these multiple visits. So, these are the drawbacks of the serial extraction procedure. It also requires patient cooperation, which should be higher. Even the extraction spaces which are created by the means of serial extraction can have the tendency of certain oral habits like tongue thirsting because the tongue has a tendency to move in the empty spaces. So tongue thirsting can be a habit which has developed in the patients with serial extraction procedure. Even they can be ditching of the space which is created between the canine and the premolar. So these were certain disadvantages which were linked with the procedure of serial extraction. So the technique of serial extraction requires the treatment in various steps. First is the incisor adjustment. Then later is the adjustment of the canines, which will further adjust or align the teeth in the dental arch. But there are certain investigations which needs to be performed before the serial extraction procedure. These investigations can be radiographic investigations, model analysis, and cephalometric analysis. The radiographic investigations require taking of an orthopentomogram of the patient for the purpose of assessing the eruption status of various teeth in the oral cavity. The orthopentomogram will also indicate all the teeth which are present or absent in the oral cavity. Furthermore, the cephalometric analysis is done 2. For the comprehensive study of the skeletal-dental relationship of the jaws in the patient. Even modal analysis is used to analyze the space deficiency which is present in the arches. The technique of serial extraction first requires the removal of deciduous canines, which will further improve the alignment of the incisors in the arch. Later on, deciduous molars can be removed, which help or facilitate the eruption of permanent premolars in the oral cavity. Furthermore, it also requires the removal of first permanent premolar. This will align the canine in the arch. But this extraction of premolar is generally done in only those cases where there is sufficient crowding there. Otherwise, premolars are not extracted. It is also done when the upper permanent canine has just emerged in the oral cavity with a slight mesial inclination. So let us come to the various modalities or the various methods which were proposed by different esteemed scientists for the purpose of serial extraction. So the three most popular and universal methods of serial extraction are Duell's method and modified Duell's method, the Tweed's method and the Nance methods. Now let us go up to the detailed description of these individual methods. Duell's method is a three-step method for serial extraction. It involves three stages. Now, the first step or the first stage is removal of the primary canine, which is done for the purpose of incisor eruption and alignment in the oral cavity. So, as the primary canines are extracted, the incisors will get a proper space for alignment and position in the dental arch. After the extraction of the primary canine, we go for extraction of the first deciduous molar. Now, underlying the first deciduous molar is the first premolar. The first premolar can be extracted thereafter. But the extraction of canine, it is done at the age of 8 to 9 years. And later on, after a period of 1 year, the molars are extracted. That is, the primary first molar is extracted to facilitate the eruption of the first premolar. Now later on, this premolar is also extracted, which will further facilitate the eruption and the alignment of the canine in the oral cavity. There is another method which is a modified Duell's method, in which we directly enucleate the premolars at the extraction of the first primary molar. But this is generally done particularly in the case of mandibular teeth, where the eruption of canine is ahead of that of the premolar. Now coming over to the Tweed's method of serial extraction. It is also known as T4C method. Now let us go on to the explanatory details of these methods. Tweed method involves first the removal of the primary first molar. Now after the primary first molar is removed, after the first primary molar is removed, we go for the extraction of all the deciduous canines and all the premolars. But the premolars are only extracted after the period of 4 to 10 months, after the premolars have fully erupted or fully pierced the alveolar ridges. Then this is done 4 to 6 months later on to the eruption of the permanent canines so as to align the canine in a proper position in the oral cavity, and they can erupt more distally or posteriorly into the dental arch with a good position. The results of this procedure will lead to the proper alignment of the incisors as well as the canine in the oral cavity and will alleviate any process of crowding. Now coming over to the Nance method, which is also known as D4C method. The Nance method of serial extraction is similar to that of the Tweet's method. Here the first step is the extraction of the deciduous molars, which will facilitate the eruption of the first premolar. And second step is to extract the first premolar, that is also known as fourth. And finally, the third step and the last step is the extraction of deciduous canine. Thereby, we can attain a proper alignment of the incisors and the permanent canine in the dental arch. So, the role of a pedodontist or a dentist is to identify and observe the problem which is encountered by the patient and make the decision whether the patient requires a procedure of serial extraction to be done or not. The responsibility of the dentist is also to make the parents as well as the patients understand the importance of serial extraction and whether it is required or it is not required, the consequences of serial extraction and the consequences of any dental crowding which can be present at early stages, which can further be relieved by the process of serial extraction. The responsibility and the role of the periodontist is also to communicate with the orthodontist regarding any problems of malocclusions in future with the patients. Thus, proper diagnosis, skill, knowledge, experience and expertise are critical for the purpose of serial extraction. This would further help in shaping the dentition of the child who would future be a proper ideal citizen for tomorrow.